We are here as nurses, doctors, PSWs, and patients to say no to the privatization happening step by step in our beloved province. I am here today as a physician to attest to you that in my clinical practice in 3 hospitals, many of my patients cannot afford their basic medications for important diseases like diabetes. And what happens, ladies and gentlemen, you know what happens. If they can't afford their medicines, they end up in the emergency room or in the intensive care unit, critically ill. The reality is, the truth is, that Ontarians cannot pay for Doug Ford's privatization of our healthcare system. The reality is, and all the powerful unions know this here today, that our hospital budgets are being gutted by for-profit, shareholder interest companies that are gouging hospitals for precious nurses that we need. The reality is, when you come to an emergency room where I work, the nurses are carrying 10 to 15 patients each, which is a dangerous ratio. The reality, Premier Ford, is that hospitals and nurses can wait no longer for assistance, and they cannot further encumbered by your privatization efforts. Ladies and gentlemen, the reality in Ontario emergency rooms today is that patients are waiting 6 hours or more to see a doctor. And you know this, when patients do get to see a doctor, they sometimes, and I attest to you, they wait 40 hours in a chair, waiting for the medical care that they are entitled to. My message is, Premier Ford, Ontarians cannot wait any longer for your privatization efforts to have an effect, and we have to change the situation now. On these hallowed grounds, on these public lands, we are surrounded by hospitals to the east, to the west, to the north, and to the south, and I have the privilege to work in some of them. But those operating rooms at Mount Sinai Hospital, at Sick Kids, at Toronto General, at Women's College, at Toronto Western, at St. Joseph's, at St. Michael's, at Sunnybrook, those operating rooms are closed, are shut, are non-functional. Mr. Ford, they are closed in the evening. They are closed on the weekend. They are closed at night when our surgeons, our nurses, our staff, our PSWs are ready and willing to work if the Premier will fund our publicly funded healthcare system. Ladies and gentlemen, we have come today as nurses, as unions, as patients, as providers, to say one simple message to the Premier of Ontario. It is time to put the health of the many ahead of the wealth of the few.
Thank you, Dr. Venogupal.